Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. For this video, what I want to talk about is compression, in particular compression garments after knee replacement surgery. What's some of the research out there? Should you wear them? Shouldn't you wear them? How long should you wear them? What type of compression garments should you wear? Some of the common frequently asked questions about compression garments and everything related to compression after knee replacement surgery. So, why we want to focus on compression as part of our recovery after surgery is that when you're recovering after surgery, there is increased swelling of your lower legs, your knee, your calf, your foot, and your ankle. And there's also, especially early on after surgery, some decreased mobility. So you are a lot of times you're laying in bed, you're resting. You might do a little bit of walking with the physical therapist, but most of the day you're not doing too much moving because you're resting, and you might have a lot of pain and discomfort. So what this does is it leads to having stagnant fluids and stagnant blood in your legs. And this can increase your risk of developing a blood clot. So when a blood clot develops in your calf muscles, you develop what's called a DVT, or a deep vein thrombosis. And this of itself is not a terrible thing. It just needs to be addressed and managed appropriately. What the risk is and what the concern is if that blood clot, what can happen is it can actually break off from the spot it's in, and then that clot can travel to your lungs and form what's called a pulmonary embolism, or basically a blood clot that has now traveled to your lungs. And this can be very serious and is really considered a medical emergency that needs to be addressed right away. So, blood clots, DVTs, and pulmonary embolism, PE, is something that we definitely want to avoid after surgery. So there's a lot of different tactics that are put into place to help reduce your risk of developing a blood clot. Some of this is different medicines, having you do different exercises such as ankle pumps and heel slides and quad sets and all those good things. And also, one other thing used is compression. So when you're in the hospital, a lot of times what you'll have is called intermittent compression. And this is compression of basically these things that are wrapped around your calf muscles, and they are going to squeeze and provide compression, and then they're going to relax kind of off and on. And that's, again, just trying to get some of that fluid and swelling and bring blood flow back out of the legs and up towards the heart. So that's something you'll have after surgery when you're in the hospital usually. Now, once you're discharged from the hospital, there's some differences in what will be recommended and what you'll have. So for some people, they'll be recommended a compression garment of some sort. If that's TED hose, if it's compression stockings, we'll get into that in a little bit. Now, on the other hand, some people might not be given or recommended any type of compression garments. And it's really up to the surgeon and your surgical team and the health providers that are working with you to determine if you are appropriate or if they recommend you having some sort of compression garments once you are discharged home or to a rehab facility. Now, if you're someone who's at an increased risk for having issues with swelling or developing blood clots, maybe you've had a blood clot in the past, maybe you're not as mobile as they'd like you to be after surgery right away, then it's probably more likely that you might be recommended to use compression garments. However, if you're someone who's relatively healthy, you're moving well and okay, you're not at an increased risk for developing a blood clot or having excessive swelling, then you might not be recommended to wear the compression garments. And actually, they've had some studies done, and one study was a randomized controlled trial where they compared people who wore compression garments after surgery and people who didn't wear compression garments. And what they found was there was really no difference in the two groups in terms of any swelling The swelling was no different. Pain levels weren't any different. And they also looked at different measures of function and mobility, and there was really no difference at all between either of the two groups. So really, it's going to be for people who might be at a higher risk of developing a blood clot or having some sort of complication where the compression garments might be more recommended. Now, there's also some discussion of compression garments or stockings that are below the knee, so meaning that they end right below your knee, and then the ones that are called above the knee or thigh high or pantyhose, and those are any kind of type of garments or stockings that are going to go up over your knee and end either at your thigh or your hip. So one of the concerns of surgeons and health professionals was that with the below knee garments, what it could lead to is causing some increased pressure and stresses right on your incision, because the elastic of the end of the garment or the stocking is going to be right on where that incision is. And they thought that that is not good for a wound that is healing and, was just, opened and just had surgery. There also was a concern that with the below knee garment, yes, you're controlling the swelling below your knee in the calf muscles and the foot and the ankle, but there's also increased swelling at the knee joint where you just had your knee replacement. So that was another concern. And there was one study that was actually done, at least one that I saw, there might have been more, that compared individuals who had above knee type of compression and individuals who used the below knee type of compression. And what they found, there was really no difference between the two groups. So there was no differences in swelling or range of motion or pain levels or complication rates. So it seems to be that concern about the below knee compression garments was unfounded. And the good thing about the below knee is sometimes they're better tolerated and more comfortable for the patient to wear. So that's another positive of utilizing the below knee compression garments or compression stockings. Now, I also want to briefly talk about the difference between TED hose, so TED hose, and compression stockings, because they are a little bit different. So a TED hose stands for thromboembolic deterrent. So basically trying to decrease the risk of getting a blood clot. And this provides compression, and it provides compression at a level of 20 millimeters of mercury or less. So millimeters of mercury is how you measure pressure. So that's just the measurement system that's used for pressure. So for TED hose, it's at 20 millimeters of mercury or less. And the compression is highest at the calf muscle. And typically, this is for people who are not as active. They're not up and moving and walking around, contracting their muscles, helping to kind of pump that blood out of the area. So this is someone who is either not active, maybe immobile, bedbound, at least significantly, or it might be someone who might use it when they're sleeping. And typically you want to use these, they'll last for about 3 weeks in duration. And it's also typically used kind of right after a surgery, such as a knee replacement surgery. Now let's compare that to compression stockings. And compression stockings are more for people who are ambulatory, who are walking, able to move around. And these provide pressure at different intensities or different levels. So it can be in the level of 15 to 20 millimeters of mercury. It can be a little bit higher in the 20 to 30 millimeters of mercury range. It can be into the 30 or 40 millimeters of mercury. And they can even have special customized garments that provide pressure up to 60 millimeters of mercury. So it can really be customized to the range that is appropriate for you. And these are typically something that is ordered by a physician for whatever reason. If they think you're at an increased risk of, maybe you have a lot of swelling, maybe you've had a blood clot previously, or you're at an increased risk based on your medical history. And these provide greatest compression level at the ankles instead of at the calf. And they'll last a little bit longer, typically up to about 6 months they'll last for you. And so these might be someone who is at a little bit higher risk of having a blood clot, having swelling after their surgery. And it might be something that's really going to be specifically ordered and provided through the physician and getting a script from your physician. So a recommendation of how long, if you are someone who was recommended to use compression garments, either TED hose or compression stockings or whatever it may be, after your surgery, what's kind of the typical guideline? Well, again, everyone's going to be different, and you want to talk to your surgeon, but typically it's the first 2 or 3 weeks. So the first 2 or 3 weeks is when you want to wear your compression garments if you're going to wear them. This is the time where you might be a little less mobile. You're at a higher risk for maybe developing a blood clot because you're not as mobile and moving and walking as much. You might be a little bit higher pain. Your swelling might be a little bit higher. So typically it's that first 2 to 3 weeks. And then another recommendation is within the first year to maybe for the rest of your life after having knee replacement, if you're going for a relatively long car ride or traveling, or especially if you're going on a plane ride, that there would be recommendation to have some sort of compression garment that you wear during your travels, as there's just increased risk of having that swelling when you're traveling for a long time, especially if you're in an airplane. So hopefully that gives you a general overview of everything related to, or at least the key points related to compression after knee replacement surgery. Again, it's really going to be an individualized approach. It's going to depend on what your surgeons recommend based on your individual situation. Not everyone's going to have compression garments and compression stockings after surgery, but there are those people where it is prudent and beneficial for them to use them to help decrease any risks of complications or issues. So hopefully that gives you some good insights. Thank you very much for watching, and take care.